pharma is a business and I'm a businesswoman. And so I recognize a good business model when I see one, and vaccines are great business. And I'll explain why they're great business relative to other things. So if you think from a marketing standpoint, whenever you want to develop a treatment, basically there's a population that you treat. So when you start launching a product, you would treat a very specific population. Say, I'm just going to give the example of cancer. So advanced cancer patients, let's say they've received lots of prior treatment and they probably only have 2 months to live. So, maybe we'll call that, like, I don't know, 100 patients, right? So you'll make some money, but you have to go through the whole development cycle of proving that it's good for that particular group, which can be very costly. And you can think a treatment's going to work, and then at the end, they would do the randomized controlled trial and it's a failure. So there's a tremendous amount of money that goes into development, conducting this clinical research in order to get even a small, what they call niche market, which would be like super advanced cancer. And so the goal in the pharmaceutical industry is to move forward earlier in treatment. The earlier you go in treatment, the more patients you get. So you get a bigger, what is called, market. I know it sounds terrible to be thinking about this, but it's a stage-wise thing, and at each threshold, you have to prove that you're better than what's the standard of care, and then you get to go to a bigger market and a bigger market. Well, vaccines are the biggest market ever because you don't even need to be sick to need a vaccine. You just need to be alive, right? And so if you can convince somebody that they need a vaccine when they have no symptoms and they don't need treatment, right? Then that's the biggest market possible. All that you need to be is a healthy adult. And I mean, the vaccine industry, basically, there's a lot of vaccines that are administered to children, and all that children need to do is be born and they're eligible for the vaccine. And then we make calculated, risk benefit analysis saying, well, this will prevent such and such a disease, which has terrible side effects. So we're going to do this, child benefit by giving them this vaccine. So, a lot of the emphasis then moves from the realm of evidence, in the sense that it does do help, to the realm of speculation, where I think that this would benefit somebody. So again, it becomes much more easy to convince somebody that they need to take a treatment whenever you're thinking of prevention, because all that you need to do is scare them into thinking that they'll get sick. So it's easy. It's good business, right? And it's a lot less risky than having to prove that something works or not. And a lot of the time, the prevention trials, if you were to do a proper prevention trial, it would take 20 years. Like, say, for instance, you say, oh, I think it's going to stop cancer. Well, you would have to wait. Cancer takes 10, 20 years to show. So you'd have to wait 10 or 20 years. Now, that's just not a viable marketing. It's just not viable from a development. It's a super costly trial to do. The loss to follow up. I mean, it's super expensive. So nobody's going to want to do that trial. So then what you do is these surrogate endpoint trials, where you basically say, oh, it developed antibodies, therefore it will prevent disease, which you might get. So anyways, I guess it moves from, I guess instead of the level of the burden of evidence getting higher, which it should for healthy patients, the standard is that it's quite low.
That's
and as long as you can develop antibodies. Yeah, it's a bit strange, but from a business point of view, that's down. You don't have to trials that go on for years. You just have to show that a surrogate endpoint changes, and you're able to. So there's a lot of motivation for pharmaceutical companies to find, to invest in vaccines because of that. I'm not saying that they haven't prevented disease and that they don't have a role, but I'm just saying that in terms of a business perspective, it's the pot of gold, right? So now, historically, it's important for you to also understand that there's regulations that have been involved. So in terms of what you can do is, if you're a company and you promote, once you have something that you think works, then you're allowed to you can have qualified people who are allowed to talk to doctors about it, right? And then, you can't talk directly to patients. You're not allowed. It's called marketing. You can market to doctors. right? You can
Hmm.
present your best, message to a doctor, but you're not allowed to present your best message to a patient because the patient isn't qualified to discern that level of data.
Mm.
And then a little while ago, they basically started to say, well, you can
Mm.
advertise, which would be kind of directly talking to the patient. But, if you do a commercial that's presenting your best message or whatever it is, marketing campaign, you need to have all the side effects, so you'll see, such and such does amazing things for you. And it causes heart disease and da, 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 like those weird
Right.
commercials that you see where they have to qualify everything, right? But a little while ago, one of the things that started to happen that was really kind of interesting, which was good for pharma, was that they started to realize if they work through patient groups, advocacy groups, that they could basically influence politicians,
Oh,
manipulate
you mean like lobby
politicians
groups?
towards a certain end. Yeah, law. Yeah. So,
Mhm.
for instance, a good example would be the breast cancer advocacy group. So, they started talking to these groups and they're not allowed to talk to people, but then they get the advocacy groups to talk to their peers. And so they're kind of indirectly marketing to patients. That
Mm.
happened, I don't know, about 4 or 5 years ago. And then it went from there to they get those advocacy groups then to do campaigns towards government to get them to recommend certain treatments, right?
Yes,
So
rent
then all of a
seeking.
sudden, yeah, so all of a sudden pharmaceutical companies are getting more leverage, right? So they're able
Hmm.
to they're able to kind of get access to people more and to influence people more. And of course, historically, we've always said that people should not be marketed to because they don't have a level of sophistication to discern whether it is actually good for them or not, right? So, a marketing campaign will, connect something to emotion, minimize harm, maximize benefits. That's just what they do when you market, right?
Mhm.
Hmm.
And so it violates people's informed consent because they're not able to carefully weigh the pros and cons of a given treatment.
Yeah,
So
and it's
then,
funny. Oh, sorry. Go ahead. Go
go
ahead.
ahead. No,
No,
no.
no, no. Finish your thought.
But anyways, it went to another level where then they started to liaise directly with governments and started to say that there's a cost benefit analysis, it's called, where they would go to governments and they would say, this disease costs you so much to treat, let's just say cancer, right? It's billions of dollars in budget. And, we could save you a lot of money by vaccinating this group of patients. It will save you money in the end. And so then all of a sudden, government was like, wow, we've got, you know, social health care, central health care. And so that's a big budget line, right? So if I can minimize that somehow, that's really interesting to me. And so then there's this collaboration between government and vaccines companies or companies with vaccines that began where the governments were kind of getting into it with the pharmaceutical companies because it saved money. Um,
Mhm.
so then you've got this interesting thing where the government was really supposed to be the regulator, the independent body that's protecting the the patients from undue influence from pharma, and yet then all of a sudden you get the government kind of partnering with pharma then to promote these vaccines to the people. Now there's no regulation that prevents a government from marketing to its people.
Right.
And so what you start to see is more and more of that where, public health will require vaccination then for various activities. And you saw a lot of that
Mm.
earlier, like vaccines for school and stuff like that. So that's kind of this partnership now between government. And now it's not the pharmaceutical companies that are promoting it to the people. It's the government that is promoting it or marketing to its people. And if it's unethical for pharmaceutical companies to do it, then it's questionable whether it's ethical for governments to do it. And so then with this pandemic, it was incredible because not only did governments move into an active role of promoting vaccines, but they basically disregarded all of the rules of informed consent. And a lot of the campaigning was basically specifically related to it's a marketing campaign where they do the classic thing where they emphasize the benefits and minimize the risk,
Mm.
and they obscure details so that the consumer isn't actually able to make an informed choice. And interestingly enough, the consumer is their actual citizen that the government is supposed to be protecting, but now is being, is now the focus of their consumption. Do you know what I mean? Like that's
Yep.
they feel that they're successful if they convince the person that they're trying to protect to take this, which, probably isn't a terrible thing if you have a safe and effective vaccine. But the
Well,
thing that I find extremely concerning about this, sorry, go ahead.
no, go ahead. Yeah. No, I'll let you finish. I was just going to apply a terminology to it. So,
Yeah, so that it would be great if it's a safe and effective vaccine, but it isn't.
Mhm.
And so what we have here now is government, not even, it moved from, active participation in promotion, then a violation of informed consents by using what I would call propaganda and marketing, actively marketing to it. And now they're moving to coercion through vaccine mandates. And so it's a very concerning ethical situation that we're in,
Mhm.
where government feels that it's warranted. However, I don't think that it would be substantiated by any normal standards of evidence. And I think it's just inappropriate that a government would be engaging in that type of relationship with the citizens that it's supposed to be protecting.
Please subscribe and hit the bell to stay up to date. If you liked or disliked the snippet, give it a like and share your 2 cents with us in the comment section. And remember, 6 cents makes change.